I got pregnant with a fibroid about 8 centimeters. Yep, that's large. Not very large, but that's considered large. Anything more than 5 centimeters is considered large. Most women who have fibroids will be able to get pregnant without issues. Having fibroids does not mean you will have issues with fertility. That's a misconception I want to clear in this video. Most women that have fibroids can get pregnant without issues. But yes, fibroids can cause fertility issues. That is what we are touching now. So in this video, we are going to talk about how fibroids can affect fertility and when it becomes a problem. First of all, what are fibroids? Fibroids are non-cancerous growths that grow in the womb. Some women have tiny fibroids and never even know. Others have large fibroids and still do not know because it's not causing any issues. While others can have fibroids, even as tiny as this, and have fertility issues, or have larger fibroids that's causing heavy bleeding, very painful periods, and difficulty in getting pregnant. Now, here's the important part. The effects of fibroids on fertility depend on 3 factors: the size, the number of fibroids, and most importantly, the location of the fibroid. If a fibroid is inside the womb, that is where your baby grows. If I want to be more medical, I would say in the uterine lining. But basically, if a fibroid is growing where your baby grows, this type of fibroid is known to affect fertility. It has a great impact on fertility. But guess what? It is one of the least popular fibroids. Most women do not have this type of fibroid. And this type of fibroid is called the submucosal fibroid. They make it hard for fertilization to occur because they distort the shape of the womb. They distort the cavity of the womb. They can block the movement of sperm. Sperm is not able to meet the egg for fertilization to occur. That's one. They can also disrupt implantation. That is the attachment of the fertilized egg to the womb. Yes, because if they are growing where the baby is meant to attach, there's no place for the baby to attach. So pregnancy cannot happen. So fibroids can also block the fallopian tube, so the sperm is not able to meet the egg. That is another bad place if the fibroid is blocking the tubes. Fibroids, like I said, can change the shape of the uterus and also disrupt adequate blood supply to the new pregnancy. This can lead to a miscarriage because the developing baby is not getting enough blood. But again, many women can conceive naturally with fibroids and have healthy babies. So when should you actually see a doctor? Number one, if you and your partner are below 35 years of age and you've been having regular, that means you've been having intercourse up to 3 times in a week. That is regular intercourse. Unprotected ejaculatory intercourse. And still no pregnancy for 1 year if you and your partner are under 35. After trying for 1 year, no pregnancy, then you need to see a doctor. If you've had a child before, or you or your partner is over 35, or you are over 35, after trying for 6 months, you need to see a doctor. But it's also very important that if you have fibroids, you need to do an extensive medical assessment for other causes of infertility because, like I said, most women with fibroids will be able to give birth naturally. Also, see a doctor if you're having heavy menstrual bleeds. So you are changing your tampons or your pads every hour, every 2 hours. That is too heavy. You are passing large clots. I don't mean small, I mean large clots. That is too heavy. You are having lower abdominal pain, so pain in your lower belly. You need to see a doctor. You've been getting pregnant, but you've been losing the pregnancy. So recurrent miscarriages, you need to see a medical doctor. Or you were told and you have multiple or large fibroids, you need to see a doctor. Like I said, not every fibroid will need treatment. If the fibroid is not causing any issue or is not a threat to future pregnancies or deliveries, you're good to go. Why disturb something that is not disturbing you? So treatment depends sometimes on fertility goals, risk in future pregnancies or deliveries, the size of the fibroids, if they're causing any complications like heavy bleeding, all of that, etc. And please do not panic just because you have fibroids. Matter of fact, 80% of women will have fibroids during their reproductive years. So it is so common. You're not the only one. If I take 10 girls now and I do random scans, do you know how many will have fibroids? At least seven will have fibroids. Some of them don't even know. Some of them did not know. So don't be scared if you've been told you have fibroids. It is common. Like I said, again and again and again, a lot of women will get pregnant naturally with fibroids, myself included. Thank you for watching. And if you have any questions, you drop them in the comment section. I will be there. If you like what I do, don't forget to hit the subscribe button. Now you know.